We know that breast cancer is the most common cancer and the leading cause of cancer death among Latina women. There are a number of studies that show that Latina breast cancer survivors have higher rates of fatigue and depression and overall poorer quality of life than other members of ethnic and racial minorities. Even with these disparities known, there are very few interventions that take into account survivorship care and focus in on this particular population. And so our colleagues at Texas Tech University Health Sciences, led by Dr. Zina Nalla, implemented a cancer survivorship program to address these particular issues in that population. The center was staffed by an oncologist, a nurse practitioner, a nutritionist, as well as a clinical psychologist. And as part of the program, they proposed an intervention study to examine the impact of a mindfulness-based stress reduction program. So breast cancer survivors were diagnosed stages 1 through 3 and had completed their active treatment and were between 1 to 5 years post-diagnosis when they were recruited into the study. They received evaluations at baseline, and as well they were evaluated on a quarterly basis over a 2-year period. And the outcomes that were of interest were focused around physical and mental health as measured by the SF-36, and as well they looked at depression and anxiety, which was measured by the GAD-7 and the PHQ-9. Participants attended an 8-week evidence-based training course that was focused on mindfulness-based stress reduction, and that was adapted by research that was in the existing literature. The training was provided in both English as well as in Spanish. So the goal of the program was to increase energy and physical functioning in breast cancer survivors while also reducing their anxiety and their depression. Participants received audio recordings and workbooks and were encouraged to practice their techniques at home throughout the program. There were 94 participants who were actually recruited into the study at baseline, and the average age was 55. At baseline, their scores for both physical and mental health were actually below those for the general population, and their anxiety and depression was actually higher than the general population. At the end of the study, both at 1 year as well as at 2 years post-intervention, patients were seen to have significant improved and better outcomes for anxiety and depression. And in particular, the population of people who were over the age of 50 showed the most improvement in terms of their depression outcomes. The results from this study are promising and point to the need for individual interventions for Latina breast cancer survivors as well as other minority populations.